So this is week one, and we're doing section one of the textbook. And that section covers the first three chapters of the book: drug use and overview, drug use as a social problem, and drug policy. The things that I particularly think are important is to look at the idea that use is not abuse. Uh, if you look at the picture on page 3, look at those two pictures and ask yourself, does the person in either of those pictures have a problem? Interesting how sometimes our viewpoint will affect how we look at things. Another important factor is to start looking at drug use as a social problem and to understand the impact that substance abuse has on our society, including the increase in STDs and other bloodborne pathogens. To look on page 32 at the DSM-5 criteria for substance use disorders. I think it's important to recognize that addiction is not really a clinical term. And when we talk about somebody being an alcoholic or an addict, those are terms that can mean different things to different people. So what we do in our field is we talk about having a substance use diagnosis, and as you'll see on page 32, there are 11 criteria that are used to make that determination, and the number of criteria that a person meets would help us to determine the severity of the problem. Looking at various views of addiction, and more importantly, looking at your own view of addiction. Next is chapter 3 talks about drug policy. And I think in this day and age, it's particularly important to understand how our drug laws got to where they are and where they might be going in the future, and how we can make reasoned decisions on what our drug laws should be. So those are some important points to look for in the first 3 chapters, and I wish you a lot of luck, and I'll see you in the discussions. Bye.